Good evening, everyone, and welcome to the 8th episode of Savikalpa Sanchaar, our monthly podcast series where we discuss chronic and common ailments and their management with expert physicians and healthcare practitioners. I wish everybody who's joined us this evening a very Merry Christmas, and I'm sure everyone is looking forward to the holiday season and perhaps many of us to some good rest too, which is the topic which we bring to you this evening, and we hope to arm you slightly better in your quest to rest. I am delighted to have with us this evening Dr. Sanjay Manchanda, who is the Chairperson of Sleep Medicine at Sir Ganga Ram Hospital in New Delhi. Welcome, sir.
Thank you.
So, diving right in, sleep disturbance is something that I suppose affects all of us. Whether it is disturbed sleep after a bout of illness, because of travel, because of our modern, especially urban lifestyles, I think all of us, young and old, do suffer from some disturbed sleep from time to time, which does lead to temporary sleep disturbance. But what is the difference, if you can elucidate, between sleep disturbance and sleep disorder? How do we differentiate between the two?
Well, essentially speaking, that sleep disturbance is something which has a definite cause that we can attribute to. It could be bereavement, it could be, say, the type of work you are doing, it could be some kind of say problem at the workplace. So these are conditional clauses, whereas a sleep disorder in itself is a condition where, there are so many sleep disorders. You'll be, say, it will be quite interesting for you to know that there are more than 80 sleep disorders. So the thing is, there could be actual sleep disorders and there could be perceived sleep disorders.
Gee.
So perceived ones are the one, as you rightly said, it is more of a conditional one. Whereas sleep disorder per se is a problem of sleep deprivation, it's a problem of the number of hours of sleep, it's a problem of the quality of sleep, and it is the irregularity or regularity of sleep.
All right, sir. And is it also chronic versus temporary? Is that another differentiator to understand whether one is just suffering from disturbance or is it a disorder?
Look, the thing is, more importantly, if you said that it is a temporary or it is a permanent one. The thing is, the temporary, again, the same point that we had talked about, is a conditional condition. And it could be, say, between, say 1 week, 2 weeks, 3 weeks.
Ji.
But then this is followed by reversal. Whereas if you are having an actual sleep disorder, then in that particular case, it will not reverse on its own. We have to make a study, we have to find out the cause. The thing is, one is a perceptive sleep disorder and one is an actual sleep disorder. So we first have to make the differentiation as to what is what and then treat accordingly.
So you have to diagnose first whether or not
sure.
there is an actual clinical
for
disorder.
anything for that matter.
Understood. You mentioned, sir, that there are 80 odd sleep disorders. I don't think that we can speak on all of them, obviously, this evening.
I agree.
The term that we as common laypersons are accustomed to is insomnia. Is this a catch-all term to kind of describe all sleep disorders, or is there a specific definition of insomnia?
Well, first thing is that it is a misnomer in itself. And it is an overused, rather abused terminology. Because insomnia actually means total lack of sleep.
All right.
And total lack of sleep, if more than 10 days it occurs, then it is not that you will not be able to live. You will perish by that time. So the word should have been dysomnia, that is poor quality of sleep. That your perception is not as good. Because a lot of times, the patients and their relatives would tell, oh, he was snoring. But he says that he is not sleeping. He was just lying down. Now, that perception of not having slept is a different condition. And actually not sleeping is a different condition. So, people who have this problem, or what is labeled as insomnia, is something which is because it is more of a symptom of perception that, okay, I did not sleep. Because if you are not sleeping well, you are taking longer time, you will say, I have insomnia. If you are having restless leg syndrome and breaking your sleep every now and then, you will say insomnia. If you are having sleep apnea, that is snoring, snorting, and getting up every, in 1 hour, say maybe around 30, 40, 50 times, again you will say this is insomnia. But they are all different conditions and they have to be managed separately in a different way. First, we have to make a correct diagnosis and then we go around doing it.
Understood, sir. All right. So, to summarize, insomnia is an absolute lack of sleep. Dysomnia is perhaps the better terminology to describe the various sleep disturbances that we perceive, whether or not they are clinical. But moving on from this, sir, again, not touching on, let's say, then the variety or the heterogeneity of sleep disorders that there are, but what are the principal? You mentioned sleep apnea, you mentioned restless leg syndrome. What are some of the common sleep disorders if we were to break it down?
Look, the thing is basically, if we talk about insomnia, dysomnia, and whatever we are talking about, the thing is, one is that restless leg syndrome is a condition which is poorly diagnosed condition and not looked into very, though it is quite formidably present. Now, in that, what happens is there's a twitching of the nerves inside the legs, especially the cuff muscles. And it can range between a slight jerk to it could be a flapping full movement, that is nocturnal myoclonus as we call it. So it could range between anything in this sector. And every single jerk is a sleep breaker at the brain level. So it is like, okay, you have say electricity on, but the voltage is fluctuating. So it's not as efficient or as good. So we have to first make our diagnosis that whether, and this can be an independent activity and it can be an activity associated with sleep apnea, because there it is choking which is going on every now and then. And as a result, the thing is there could be jerks because of that. Like if you are choked and you move your legs and hands. So that could be there. Another important issue is that a lot of these patients might have, say, lack of iron or reduced amount of iron. So iron supplementation might help in some cases. But having said that, it is very, very important that we do understand that it can actually happen as a totally independent activity. So if that is so, when we do a sleep study, we see, okay, there was a jerk followed by a cortical or a brain arousal. So we know that, okay, this is the thing which is causing the arousal in the brain. And as a result, then we need to treat that condition. And sometimes there are more than two sleep disorders which are functioning at tandem with each other. And once, our diagnosis is very clear, then we have to treat all the 2 or 3 things together. It would not be very correct to treat just one of the 3 because it's not going to work.
Understood. कई लोग बोलते हैं सर दैट नींद अच्छे से नहीं आती है, जल्दी उठ जाते हैं, सो नहीं पाते हैं. These are all, I suppose, catch-all general definitions that people use. Yeah, the thing is
actually, मैंने कहा ना कि the perception of patient is that I haven't slept. Though it could be because of excessive amount of dreaming, it could be because of restless leg syndrome, it could be because of sleep apnea, and it could be because of sleep architectural problem. That when we say architecture, it essentially means basically that there are 3 or 4 stages that we do. That is awake phase, stage 1, stage 2, stage 3, and REM sleep. The thing is, if you do not have these in an order, and if something is having more share than it should be having, again that is called being awake. Like REM sleep is the sleep where we have dreams. And this is essential. Essential means that it is important for memory consolidation. But if it shoots over 20% of the total sleep, then in that case it is eating up the space of the deep sleep, which is your restorative sleep, which repairs your body, which improves your immunity. So that is being targeted then. So if we have 100 rupees and we thought that, okay, we will spend 20 rupees on this thing. But eventually we went on and spent, say, around 40 rupees. No, all we had is 100. So somewhere the compromise has to be developed, and it will be at the expense of deep wave sleep or Deep sleep, where you have these say markers which will tell us that your body is being restored, your muscles are being eased out. Along with that, your immunity levels will increase. So that, and in children it is important that the growth hormone will decrease. So as a result, the thing is, you may have a stunted growth as compared to the normal selves.
In adolescence and in children, if there is disturbed sleep, then that does lead to overall developmental deficit as well.
Yeah.
So are there sort of common underlying factors or triggers that contribute to these various types of sleep disturbances? I mean, do we have a generalized understanding of what some of the common reasons leading to sleep disorders in particular, not perceived, let's say, poor sleep for short periods?
The thing is, basically, today's lifestyle itself is a bad thing. The use of screens on, say, mobile phones and iPads, they themselves are enemies of sleep. Smoking is an enemy of sleep. A lot of people feel that if we have a nightcap or a drink or so, we will sleep better, which is wrong. Because it may initiate the sleep properly, faster, but it is a very poor maintainer of sleep. And in fact, it causes REM rebounds where you have nightmares which will be much more than other ones. So the thing is, smoking, excessive amount of now tea and coffee also will be stimulants. Smoking is also a stimulant. So as a result, it will activate the system rather than, calm it down.
Understood. All right. You mentioned diagnosis is a critical element to understand whether or not a person is suffering from a sleep disorder and therefore what type of sleep disorder. I want to query you on sleep architecture. You mentioned sleep architecture. Is that a common sort of, diagnostic tool that is deployed? And can you share some light on what that specifically is?
Yeah, the thing is, actually, we have access to very good devices where we study the sleep, in which we study the brain activity, the eyes, the muscles, the heart, breathing, body position, leg movements during sleep. Everything is being live recorded in the, next room. And as a result, we know that, he took that much of time to go into sleep. He has this sleep architecture means that he has this much percentage of dreamy sleep, this much percentage of deep sleep. And if there are a lot of arousals, are these arousals related to sleep apnea or snoring, or are these related to restless leg syndrome, or maybe because of excessive amount of dreaming? Sometimes, in dreaming, generally the important part is that our muscles go into atonia. Atonia means that they do not have function. They are placidly placed because we should not be enacting our dreams. So that's a protective mechanism of the body by the nature. But having said that, in some people, these wires are severed. So sleepwalking, sleep talking, sleep violence, that would occur in those kind of patients much more than otherwise. So it's important when we do a sleep study, we study all the parameters of, as I told you, the brain activity, eyes, muscles, heart, breathing, body position, leg movements. So we can make our, diagnosis based on these parameters. Okay, how much percentage of sleep is occurring? Is it very delayed? Then we can make it out, he has got a delayed sleep onset disorder. Then you can have, a condition where you have early wake up. Then there is a condition which is related to your work profile. India is the world capital of call centers. So younger population is exposed to, the other way around in life. As a result, and day sleep can never replace the night sleep. So slowly our society is becoming, one, sleep deprived, and second is that the amount of, road rage and everything, because we are not rested enough. So those things also keep on increasing. And apart from that, if you have sleep apnea, you have high blood pressure. It is the single largest cause: strokes, heart attacks, deaths during sleep. Then 35 to around 40% of the roadside industrial accidents, they occur because of sleep deprivation from any sleep disorder. Because it will be interesting for you to know that a person can go from wide awake to deep sleep in less than 10 seconds.
Oh wow, really?
So All you need is a snooze on the wheel, and it may last for eternity.
Well, that's sobering, certainly, and something for, I suppose, all of us to keep in mind.
Yeah.
If we, sir, move to the other end of the spectrum, and especially I think this is something that one has observed post the pandemic, a lot of people are complaining of sleeping too much. So there are people who are suffering from a lack of sleep, but a lot of people are also complaining of, sleeping more than they are accustomed to. Now, the term that I'm familiar with is hypersomnia. I'm not sure whether that's the right term in this instance or not.
It is the right
But
term.
so that also, sir, falls under the category of sleep disorder?
Yeah, it does. The thing is, if you are having a lack of sleep over a period of time, the thing is, during the COVID period, anxiety and irregularity in your functional methodology. You're watching television, you're watching OTTs, say late in the night, 2 o'clock. So your internal body clock has got, a bit confused as to what is your real time.
Mm-hmm.
So as a result, what happens is that it may get reflected into the day. It may get reflected into any kind of situation. So we first need to understand the basics, whether the problem came first, whether the problem of, say, COVID was the instrumental in doing it, or whether you already had a sleep, disorder which got accentuated during this period.
Understood. And how does one differentiate that from just fatigue? I mean, could it just be that once again you're just sleeping more because you're tired? And when is it a cause for concern, if I could put it simply?
Actually, fatigue is, there are two types of fatigues. There's a body fatigue and there is a mental fatigue. So if you are working on a strong mental kind of a workout, maybe some important kind of software development, otherwise, or you are intensely working, you get fatigued more in brain.
Mm-hmm.
But if you are walking a lot, moving a lot, and driving a lot, then it could be physical.
Mm-hmm.
So the thing is, we first have to identify what is fatigue, and in this person, what is the cause of, in which category we should draw him into. So that will depend upon a detailed kind of a history that we take from the patient, and then only that we can treat the patient properly. And if the need be, we need to do a sleep study because there are a lot of times that the perception of patient is totally different. Where a lot of patients come that I haven't slept for 3 months, which is not humanly possible. But the thing is, their perception that they are not sleeping was important. But when we do a sleep study, we find out that there was 80% sleep efficiency.
Mm-hmm.
Though it could be, say, like excess of one particular part of the sleep and decrease in the other part.
Understood, sir. These days, sir, given the flood of information that every one of us has access to, especially on a mobile phone or a computer, I suppose we all access Dr. Google for various sort of remedies, understanding, self-diagnostics, as the case may be. There are certain terms associated with sleep, I think, that everybody is familiar with, one of which is the circadian rhythm.
Mm-hmm.
And we oftentimes hear in casual conversations or in, maybe formal sort of, discussions on sleep and quality of sleep management about the circadian rhythm. Can you briefly speak to what that is?
This is actually, we, as nature has given us, we have our own circadian rhythm.
Mm-hmm.
Rhythm means, circadian is that, okay, when are we sleeping? When are we getting up? How much percentage of sleep we are in actual sleep, and how much is, say, whether the perception of sleep is poor, everything is looked into. So the internal clock of the body and the external, if they go into a mismatchment, like if you are awake late night parties and you're glued to your phone, it emits basically all these devices, for that matter, that they emit a light what we call as blue light. And blue light has got the same frequency as that of sunlight. So mental and retina, it feels that it is day. So that is why we say that if you are not in an emergency workout like medical profession or police, then you should charge your phone in another room and you should switch it off, not on silent mode. because a single tinkle will break your sleep, and you would reflexly pick up the phone and look into it. So that gives a kind of a stimulus, and it does not allow you to go into a normal sleep. So it's very important. Today, the children, 5-year-old child, he knows where his cartoon is. He picks up the iPad and he goes to that site, and he's seeing it.
Yes.
So it is very, very important that they should not be exposed to these kind of things, because actual reading is totally over. It is all auditory. And for parents, whatever, it is a good riddance. If the child wants to eat, they'll switch on a kind of a mobile or switch on an iPad. He's watching and passively, just gulping down their food. So these things are something where people have to be very wary, and they need to inculcate good qualities in their children from this day one. The exposure to these kind of things can always be bad.
Understood, sir. If we can speak about management of poor sleep disorders, I am certain that there are various tools and medications which are commonly used. Could you speak to maybe some non-medical interventions? Are there some things that one can consider as a first sort of, activity?
The thing is, first and the foremost is the correct diagnosis. Because there is no thing which we can call it as panacea. That is, it will not heal everyone. Now, in that case, as far as if you are talking of natural, then it is important that we adhere to the timings very correctly. That is I'm not saying that you have to be very, deep into it, maybe half an hour up and down. But it could not be that one day you want to sleep at 11, other day you want to sleep at 2 a.m. in the morning. So then it causes. Then jet lag is something today we are a very frequently moving population. So there are time zones which we traverse, and as a result it causes a huge amount of jet lag depending upon the perceptibility of the person. It could be lasting for say many more days in some people than less. And some people might need a less kind of a time to acclimatize. There are medication for it so that you sleep at the right time and slowly get better. But all said and done, first is clean diagnosis. Second is, yes, our own system of medicine, or rather our own original lifestyle methodology, the pranayama and meditation can help a lot. Pranayama reduces your stress levels, and meditation is a very powerful tool. And it is something which you can't do it overnight. It happens to you over a period of time. So if you are doing that, then it has been now studied and it has been validated that people who are doing regular meditation, they require 2 hours of sleep less than the normal person. And it has been documented at Harvard and other places as well. So
they're physiologically as rested in terms of their markers than anybody getting
they are fresh,
normal sleep.
Absolutely fresh.
And when you say it's a meditation, do you mean practices like Yoga Nidra, for example? I mean, is that
Yoga Nidra is a different concept.
Ji.
Normal meditation is like nothingness. And this comes with the practice, and it happens to you if you are doing it, maybe for 20 minutes at a stretch in the morning and in the evening, you might have only few seconds of that, but they are also powerful enough. And pranayama is something which releases your body of this thing. So actually we have a kind of what we call it as sleep hygiene points.
All right.
In sleep hygiene, the first and the foremost is the regularity of sleep. And second is that go to bed only when feeling sleepy. Bed is not a sleeping pill. So don't go and you will toss, turn. That will create a negative feedback cycle. Third is, no matter what time you sleep, your get-up time should be common. For the simple reason, your internal clock will not change. Otherwise, if you try to oversleep to compensate, then it is going to shift further. Third is that is you remove any. This is specifically for people who are having insomnia or dysomnia. Remove a clock from your room, because if everybody else is sleeping, every 5 minutes you are looking at the clock. Abhi bhi nahi aayi, abhi bhi nahi aayi, it hasn't come as yet. So that will create a negative kind of a feedback into your system. Then switch off your mobiles, your iPads at the bedtime. They should not be with you. Because the thing is, you can watch all your messages the next morning, right? And apart from that, then the fifth or the sixth thing that would be, that is, you switch off the television at least 40 minutes before stipulated time of sleep. Reason being that, you are feeling sleepy, but you are seeing a very intense program which you are liking. You tell, okay, another 10 minutes and I'll go off to sleep. By that time, that sleep cycle ends. So next one will come now after 1.5 hours.
Yes.
Again you say, abhi to aa rahi thi, ab nahi aa rahi hai. It is something which is really weird. Then on top of it, avoid tea or coffee after 6 p.m. Because they are stimulants, so they will not allow you to sleep. Seventh is that, okay, if you have to, you can take a warm shower before bedtime. That loosens the muscles, because a lot of people feel that by getting tired we'll sleep, which is wrong. A tired body can never sleep nicely. Just then, if you are tired and you are having you will put your pillows in your knees and sleep, because you are not rested. So after 6 p.m, no heavy exercise, as our young people do. They hit the gym around 7 o'clock.
Yes.
So which is wrong. Exercise should be maintained in the daytime, not in the evening time, and certainly not during the period at least 1 to 2 hours before the dinner. So again, important thing is that the food should be taken at least 2.5 hours before the bed. Reason being, you need your food to get assimilated downwards, and otherwise, the acidity, reflux, they could be the things that could add on to your problem. So that has to be looked into, and a warm shower, as I said, will help you otherwise as well.
So these are some very good, suggestions and intervention. I think you reflexively spoke of many of the habits that a lot of us sort of are accustomed to without thinking about it. कोई ना कोई इन सब चीजों से, I'm sure, we all kind of end up, indulging in these.
Actually, at any given time, 33 to say 40% of the people suffer with some or the other sleep disorder.
One question, sir, I have on melatonin. Melatonin seems to be something that is on the tip of everyone's tongues over the past few years, and there are supplements in market.
It's a good marketing.
What is melatonin and why?
Melatonin is a hormone which is secreted by the pineal glands of the body, and the best secretion occurs in the pitch dark. When you are sleeping, the darkness would get it released. Actually, it is to be used only during jet lag.
Right.
It is not a sleeping pill to be used regularly, because otherwise our whole system will become dependent, because body works on feedbacks. And if it is already supplemented, your pineal glands will become redundant. They will stop secreting that particular thing. So one should not and never try and replace the natural thing by an unnatural thing. So melatonin is to be used, okay, you are coming from America, and in India the jet lag, when you move eastward, it is a bigger jet lag than when you move westward. So the thing is, okay, today you have reached around 8 o'clock, you take the tablet around 8:30, or maybe even in the flight for that matter, at the ending time of the flight, and take it for a few days so that your system becomes regularized. But this is not a medicine which should be used far too much.
Understood.
And it should be used only for jet lag.
specifically. You mentioned, sir, that
And
melatonin is
occasionally shift workers.
also who have non-normal sort of working
Yeah.
hours. You mentioned, sir, that melatonin is only produced when it is pitch black. All of
More
us,
during when there is like when the lights are off. More during that
so
period.
it all of us have some electronic devices these days at home,
That
even
is
if
what
it is
I'm
not
saying.
the mobile phone, but it could be your television set which
It
emits
could
a
be
little red
computer,
light
television
or
set,
something or the
laptops,
other.
anything.
That amount of light also can
Oh,
potentially
that is
impact.
causing a problem because it has the same blue rays.
Okay, fine. So I think this is something very important for us to note, and perhaps I don't know whether to put some kind of a tape maybe on your TV, where there's a red light coming out of it, or your air conditioners
No,
oftentimes
the thing
have
is,
a little light
it is
emitting.
something which is more to be, concerned with your discipline. You should understand that. You don't need to have those kinds of indicators telling you. But yes, you can add on to those indicators as well. But if you are knowledgeable enough, if you are well read, okay, fine. This is the time when I switch off all my devices. I'm not functioning with the devices. That is the key.
Understood, sir. I think that this has been very insightful. I would like to thank you for shedding light
You're welcome.
on some of the sleep disorders, understanding what insomnia is, what the difference between insomnia and dysomnia in particular is. And I would like to now just open up to some questions if there are any. So just requesting all of those joining us, if you have any questions, put yourself on off mute or maybe put in questions into the chat. Just a minute, sir. So we have one question from Varun who says that I've noticed I often wake up at 3 a.m. and can't fall back asleep, even though I don't have trouble falling asleep initially. Is this a specific type of insomnia, and what should I do?
What is the time of sleeping? That is more important now. If you are sleeping at around 10, 9:30, 10, then this is a normal kind of a time period. 6 hours is as good as anything.
Understood, sir. Understood.
So the
Varun.
thing is that, but if it is something you take, there are disorders like, where we have insomnia of sleep onset and maintenance. One is purely sleep onset insomnia. Third is, you have a broken and fragmented sleep. Now then, in that case, we need to know with a sleep study that what exactly is there and then treat that particular thing.
So, second question, Tamanna wishes to know whether there are any specific physical or breathing exercises you already mentioned, but are there any
Pranayam can help you.
specific physical exercises also?
The thing is, they should be done in the morning, not in the evening.
Yes, you made that important point as well, and I think a lot of us do end up trying to exercise after the end of the day effectively. So there we have a question from a student, Umar, who wants to know that he tends to stay awake the night before my exams. The stress keeps me awake and I'm unable to pay attention to my revision either. What would you suggest to a student like me who is unable to sleep before I suppose an
the
examination?
thing is, for him, if he can perform pranayam, it will help him. The thing is, everything should not be treated with medications because they will alter your system in other ways and may not be very good on a long-term basis. And as far as anxiety is concerned, it is going to lower down the anxiety level.
If I may, sir, we have one more question, but because you mentioned medication, I know a lot of people, including family members, who are consuming sleep medicine for I feel like a decade or longer, and it's almost part, like you mentioned, whether it's a nightcap where people think that they are benefiting from that, but medicines such as your benzos, for example, Alprax, I think is the most common medicine one oftentimes sees, whether 0.25, 0.5. I have 2 people in my own family who do consume Alprax. Is that also similar to what you mentioned on the fact that you just build dependence on these medicines, or do they actually
the
help?
dependence overall definitely will happen because all these are chemicals. So there is nothing else, but they have to be used judiciously. You have to find out that okay, he needs it, and Alprax is an anxiolytic agent. It decreases the anxiety of a person. So if the person is having some anxiety, okay, you can give him. But going on for years is something you have not even explored yourself. That is more important. If you added pranayam to your regime, if you added, say, daytime, say, exercise to your regime, if you are not having the right kind of food and the right kind of a difference between, everything will count. So it is important that we first know that why are we consuming these medication. A lot of people do not need them and they are taking medication because it's an easy way out. And second is that, okay, the thing is, if there is an actual need, we have patients who've been taking medicines for a long time, but that is if you are having an inherent sleep disorder in your system.
Understood, sir. Thank you for that clarification. One very pointed question, sir, from Jyotika. I am 5 months pregnant and struggle with sleep. Frequent urination keeps me awake the whole night as well. Can you share some insights on insomnia during pregnancy, and will this subside automatically?
They will subside.
All right, fine. So it's transient and something which is common and not to worry.
Look, the thing is, you are carrying extra amount of weight. Your bladder doesn't become fully void. You can't do that, so you have to get up again and again. Maybe you take a lot of water or some amount of extra water during this period. That will also have a effect on the things. So the thing is, but this is generally transient. But yes, motherhood is itself a very, very important thing, which you can't. It's a natural process. You can't control that.
Understood. Once again, Dr. Saab, really appreciate your time and the patience with which you've answered our queries. We hope that this engenders greater awareness at the level of our listeners and perhaps those in future as well, so that we recognize the importance of sleep as an underlying, probably the most important determinant of overall good quality of life, and which can hopefully prevent other chronic disorders.
The thing is, it will
as a
help.
consequence.
It will help a lot of things. It will help a lot of things.
Appreciate your time. Thank you once again, Dr. Manchanda. Thank you.
Thank you.